Good.
Hello and good evening, everyone. You will have been muted. Whatever you need to communicate, just put it in the chat. And we are just starting in 1 or 2 minutes as people are still joining. And you all know that a big question about RCI license, lot of myth, lot of facts we have to know related to clinical and counseling psychology. And why is it necessary? What are the government rules regarding RCI license? So we are going to talk about this today. We have a speaker, Kavitha Ravi, and she herself is a Rehab RCI licensed clinical psychologist. So we will just start in 1 or 2 minutes and understand what is RCI license, what are the rules, regulations of Government of India, and how you can obtain the RCI license for clinical and counseling, and where it is really compulsory. Okay, so just 2 minutes and then we start officially. Thank you. Whatever you have queries, either note it down, we'll take question answers at the end, or put it in the chat so that the Kavita can just have a look at the chat if you have any questions, and later on at the end, she can answer it. Most of your answers will be covered during the seminar only. So just 2 more minutes and we start. Okay, so it's 8 o'clock and not on time as always. So I welcome you all on behalf of Amitabh Psychology. I'm Rinku Jain, and we have eminent speaker today, Kavitha Ravi, and she is a consultant, clinical psychologist. She is a RCI registered rehab uh, psychologist. So let's have from her only, and she will first explain what she has done, what's her background, and how she came into this clinical psychology. Because most of you are not from psychology background, but you have entered this field because of your passion, your interest, or you want to do something for the people. Same is with Kavita, and she is also an addiction certified professional from NIMHANS. So a lot of qualifications from her. And yes, over to you, Kavita. So please.
Thanks, Rinku. Thanks, Amitabh Psychology and Amitabh Sir for this opportunity. I'm also a student of Amitabh Psychology. My psychology uh, career and the transformation took from there. When I started, I still believe I couldn't have cleared my stats and research paper without Rinku and Amitabh Sir. So thanks to that. And I specifically wanted Rinku to put my qualification in that screen because I'm actually a BCom MBA finance grad. Okay, and I was a banker throughout major of my life. And I shifted to psychology around during just before COVID. And after that, I completed my MA and I did PG diploma in mental health, and I did my PG diploma in rehab psychology, which is an RCA affiliated course. And now I'm an RCA affiliated rehab psychologist. My specialization is in clinical, but I'm also an addiction profession by nature. But I'm in such a place that I don't get to choose. So I attend to all clients whoever walk into my clinic. I have an office set up and I am based out of Andaman Nicobar Islands. And so let us start off with this, Rinku. Shall I start off with the presentation?
Yes, yes.
Mm, are you able to see?
Yes.
Yes.
Okay. This is just an introduction. I run my own firm called Tranquil Radianz at Port Blair, Andaman Nicobar Islands. And okay, what is RCI and why is it important? RCI is a government body which is called Rehabilitation Council of India. And basically, it has a lot of rehabilitation function and special education. See, rehabilitation means it is only functioning, Rehabilitation Council as of now functions only on rehabilitation, and they concentrate more on rehabilitation of disabilities. Disabilities in the sense your physical disability and kids with, the 21 categories of disorders, which are like autism, Down syndrome, and etc., cerebral palsy, and all that. These RCI's rule is for to develop and regulate training programs. It has a minimum standard and it also maintains a register of qualified professionals in the CRR. That's what is the number which we get as CRR number. And basically it promotes research. And they are supposed to take action against unqualified individuals who are practicing with the saying that I'm a clinical psychologist or something without a CRR number. And RCI was established as a society in 1986, and RCI Act was passed by the Parliament in 1992. So from then on, for psychology, we are always thinking that RCI is the only body through which we can practice as a psychologist. Okay, who are the people who are registered in this? These are basically, we know clinical psychologist. I guess everybody knows what is a clinical psychologist. Who does MPhil in clinical psychology, or there is also a professional diploma in clinical psychology. These two are RCA recognized courses. Same goes with rehabilitation psychologist also, where there is a MPhil in rehab psychology. Also, there is a PG diploma in rehab psychology. And we have vocational counselors, B.Ed and diploma in education. We have occupational therapists. We have audiologists. We have speech therapists. We have so many people. And counseling psychologists do not need an RCI license unless we work in a rehabilitation setup. Rehabilitation setup in the sense where we are working with closely with people who are having specified homes for autism or any kind of challenged kids, or a de-addiction center where a rehabilitation professional is required. And for doing an RCI course, it is mandatory that we do it in person. There is no shortcut to it. It has to be a 2-year or a 4-year full-time course if it is an MPhil, or if it is a PsyD. PsyD is equivalent to doctorate. Like in normal, we call PhD as a doctorate for us. So in psychology, it is PsyD. And same way, the diploma courses are 1 year. B.Ed and B.Ed are 2 years. Occupational speech therapies, BSc, so many are there, and career guidance and counseling is also there. These all are registered by RCI. And we have to complete the RCI recognized course in the specific educational institutions which is given in their site. And this list keeps changing every time. We'll have to keep looking for the list. After we do the course, we have to there are a few documents which we have to obtain from that particular institute and apply for a registration with the RCI and receive the CRR number. Receiving the CRR number is quite simple. Only thing, we'll have to get all those documents, the mark sheets and everything, and just apply in their site. With an online fee of 1,000 rupees, then you immediately get. And if people are doing MPhil and some other course outside, like they are doing some postgraduate diploma for clinical psychology outside India. For these people, just like Medical Council of India, if you have heard, they conduct exams for the doctors who studied outside. RCI also conducts some exams for passing the ethics and psychological assessments and interventions in India. So these is also conducted periodically by RCI. And this basically focuses on the ethics psychological assessments, and the interventions which is required. And if you want RCI license, we can focus on hospitals and mental health clinics, governments, private healthcare institutions, teaching and training in RCI approved institutions, rehabilitation and disability centers, and you can also do as a private practice as RCI approval with RCI approval. Difference between clinical and counseling psychology in RCI context. Clinical psychology with is RCI licensed basically, and counseling is not RCI licensed. Clinical psychology focuses on the mental disorders or personality disorders to the core. Like if you talk about bipolar disorder, schizophrenia, schizoid type of disorders and all that, which requires diagnostic and frequent medical visits. This requires RCI license. Counseling on the other part, we deal in the day-to-day problems, the stress, the career, personal development, anxiety issues, anger management. All these do not require an RCI license, and we can do basically into the counseling itself. For counseling psychologists, our pathway is, too huge. Unlike RCI licensed professional, I believe a counseling psychologist can, go into various pathways like, corporate HR roles, school and educational counseling, private therapies, NGOs and mental health advocacy, family therapies. We can go into substance use disorder. Nowadays, there is the sports psychology which is coming up. And there are so many other fields which we can go into. Sir, talking of family therapy and substance use disorders, there are separate certifications for skill development which are available in these fields, which you can do. And just start your practice for this. And how to check for RCI approved institutions? We have to go to www.rehabcouncil.nic.in. You can check the latest list of RCI recognized colleges and universities, whether they are offering regular mode, distance mode. And after verifying if the institute is there, we'll have to verify with RCI whether they will provide an RCI registration. Even the blacklisted institutes are mentioned there. So we can cross-check with this. And practicing without an RCI license in India as a clinical psychologist or a rehab psychologist is illegal. We can't just say, like, suppose I have a MA with a clinical specialization. I can't say that I'm a clinical psychologist just because, I have completed my MA. Okay, and counseling psychologists should also practice within their ethical limits and usually refer clients with severe issues. Misrepresenting oneself as a clinical psychologist without an RCI certification is punishable. Okay, common myths about RCI license. You cannot get an RCI license just with the MA or MSc in psychology in distance mode. Okay, any kind of course which is UGC approved is you can apply for a RCI license, provided you complete RCI course from the institute which is prescribed. Just like I did my master's from IGNOU, and then I did a 1-year course with another institute which is approved by RCI. So this is what. And PhD in psychology cannot replace MPhil in clinical psychology. PhD is a teaching oriented. It is more academic oriented, but MPhil is practice oriented. And RCI is only for clinical psychologists. No, RCI is for rehab psychologists, occupational therapists, speech therapists, vocational instructors, anybody who's dealing with rehabilitation. And clinical psychologists with RCI can prescribe medicines. No, a strict no. We have something called clinical psychopharmacology. Okay, but we don't have that course in India, and we cannot prescribe medicines at any cost. Prescription is only by a valid MBBS MD psychiatry doctor or a DMB doctor. So if somebody wants to do an RCI related course, first you choose an RCI approved psychology course. Join in that particular college which is approved by RCI. complete your training and the internship, then apply for a RCI registration and keep the records updated. And after RCA registration, also the continuous professional development, you are supposed to accumulate a number of points. Like for 5 years, I think it's 100 points. So these workshops keep happening all over India. You'll have to enroll and accumulate these points also. These are mandatory. And other than that, for counseling psychologists, this is a new commission, National Commission for Allied Healthcare Professionals. Okay, NCAHP has Act covers 56 allied healthcare professionals categorized under 10 broad recognized categories. So under this, we can register as a counseling psychologist. This NCAHP is creating a centralized registered for all these psychologists, other than people who are registered with RCI. So later on, what happens is we can get a registration from the government under NCHP as a allied health professional. And this is, if anything is there, you can just ask your questions, I can answer.
Can you just stop shares, Kavitha?
Yeah, I'm doing.
Okay. Thank you so much, Kavitha, for such a brief and quick review, because many students have a confusion about the RCI license. There very much myths are in the market. Okay, and even counseling psychologists are confused. So you have given a lot of clarity. Plus the path what is being taken for an RCI license, it is not easy. You have to be, it's like same as MBBS doctors, right? Okay, and they are being registered under Medical Council of India. So this is the same for clinical psychologists. Now with MPhil and PhD, what Kavitha had mentioned. So MPhil, this is the last year for MPhil. UGC has scrapped MPhil. And you have to compulsorily do PhD from a RCI registered institute to get your RCI license as clinical psychologist. What Kavitha has done, she has taken an RCI license for rehabilitation psychologist. Okay, it is for rehabilitation, it is not clinical psychologist. Be clear with the terms.
I'll just interrupt. See, the MPhil has been scrapped from this year, but instead of MPhil, there is an MA clinical psychology which is come into picture. So from next year, it will be Masters in Clinical Psychology. And whoever has completed their Masters in Psychology already, if they want to become a clinical psychologist, they'll again have to repeat the Masters in Clinical Psychology to get that clinical psychology tag. And there is one more thing from next year, whoever does not have a UG in psychology cannot pursue a Masters in Clinical Psychology. That is also a new rule which is getting implemented. And instead, they have introduced a 4-year BSc honors degree, which will enable them to be a clinical psychologist, assistant clinical psychologist after finishing the 4-year degree. Now, this whole thing is still under a confusion because every day there is a new rule and new program which is coming in. So we'll have to wait and see what happens next year.
Right. So this is under the new education policy document 2020, which I will be again sharing. I have already shared it in the groups. I request all the students and all the listeners who are listening to this particular information, the seminar, that go through the Rehabilitation Council of India website, download all the documents and understand the nitty-gritties which are being proposed. What are the rules that are changing? That is very, very important, and don't get confused. And be very clear, if you're not from a psychology background, I don't suggest you to go for clinical psychology because rules are becoming more stricter. For counseling psychologist, it's a bit relaxed now. As Kavitha had mentioned that NACPH is, you can register yourself. It's very easy to register. You should have your Aadhaar card, PAN card and all those documents ready with your mark sheets and other valid qualifications, and you can register yourself as a counseling psychologist on that government website. And these are the basic things, right? And PhD and all what Kavitha had mentioned, BA psychology plus MA psychology, what is being introduced now has to be from a RCI registered institute. Be very clear with that. It is not online, it is an offline course. Okay, PhD is not online, it is an offline course. Be very clear with these all things. Right. And PG diploma, which Kavitha has done to get a rehab RCI license, you have it in IGNU, you have it in Amity University also, but they are affiliated to RCI. So you have to check in RCI website which institutes are registered under RCI in your cities and do necessary whatever is required from your side. Okay, so Kavita, if you could go through the questions in the chat and then we can take the questions from the people who have raised their hands.
Okay. I have done a course, is it online, related to addiction? Yes, it is a certificate course, online course. It is not an offline course, but the thing is, they will call for, you will have to submit your profile. If you get selected, then you can do the course from NIMHANS.
Please stick
Okay.
to questions related to RCI. Please, this seminar is for that purpose. Yes,
Okay.
next.
Now there is a new course at IGNO PGDRPC after MAPC. Can we do? Yes, you can. It is a diploma in rehab psychology. It is approved by RCI. But only problem with IGNO is they are having only 200 seats all over India, and it is based on the merit system. So if you are able to get seat, well and good, you can do it. There are also other courses in IGNO. There is a two certificate courses are there, three certificate courses are there. And there is one PG diploma in disability management is also there. There are 5 courses which is approved this year along with B.Ed and M.Ed. You can check on that. After MA clinical psychology, SK, Soni Kaur. After MA clinical psychology, you can do a lot of specializations like lots of available there. It depends on what is your interest. You can do ABAT certification if you are interested in autism and child related. You can do substance use disorders like that. After doing, after PG diploma and RP, we'll be known as rehab counselors. So PGDRP is started, Anju Goel, it has started, but actually because July 24 was the first batch, they are still not able to, they didn't have the material also. So I have also enrolled for a certificate course under RCI again, but even the material has not come. So we are waiting for it. Yes, a counseling psychology can work in a rehab center. Not necessary for a RCA. You can work as a counselor over there. Abhijit and
Thank you. Thanks for that. I mean, it got clarified. I just have one question, Kavita. When
yeah,
you're talking about the rehab,
Abhijit, sorry to interrupt. Just let us finish with the chat questions and then we go in a sequence, please. Please, please.
okay. Instead of counseling, what can I decide post? Sunil Kumar, it is MA, whether you complete clinical psychology or counseling or organizational, it's only an MA psychology. You can call yourself as psychologist, but your specialization will be in applied positive psychology. PGDRCP in from IGNO as an annual base. No, I don't have an idea, Suresh. You'll have to check with IGNO site.
Please stick to questions related to RCI licensing and not any other courses, okay? Please.
We can get 3 certificate courses in IGNO or distance mode. We can get post. Yes, Nikita. Yes, you can get after doing the certificate courses also RCI license. But there are these nomenclatures which are attached to that. Okay, like if you do a PG diploma in rehab psychology, they will be called as rehab counselors. And for the certificate program, there is something, I forgot what is the nomenclature for that. There is something for that.
Okay, so let's have questions from these people who have raised hands. Yes, Vanaja.
Yeah, thank you, Rinko. Kavita, I have 3 questions, but not the big ones. This presentation that you just shared, is it possible to share it on Amitabh WhatsApp group so that we have a...
We will be sharing the YouTube recording for this.
Okay. Okay, to continue with my question, I am an undergraduate in psychology and I'm pursuing clinical psychology. Now, if I take this 1-year diploma for RCI licensing, I can call myself as a clinical psychologist?
No, you can't. If you take, see, there are two diplomas, okay? There is one professional diploma in clinical psychology. There is also a PG diploma in rehabilitation psychology. It depends on which professional diploma, which diploma you're going to do. If you do a PDCP, you will be called as Associate Clinical Psychologist. And
Okay.
if you do a PG diploma in rehab psychologist, as per the new nomenclature, it is Associate Rehab Psychologist.
Okay, you spoke about this ethical certification. How does one get that? If
No,
in
no,
case.
it is not for people who are done from here. Basically, it was for people who do it from abroad and come and get their certification done here. Like if you see a doctor person who's studying in China or in European countries, when they come back to India, they have to clear an exam from Medical Council of India to become practice as a doctor here. Same way, if we are doing a course abroad, we'll have to come back to India and clear a course from RCI to practice as a psychologist here. So that consists of all this ethical consideration, and it will ask about the psychological assessments and everything.
All right, I'm good. Thank you so much.
Yes,
Welcome.
Namrata or Sumit, sorry, Sumit. Sumit Pateja, you can unmute yourself. Oh, I think he's not able to hear. Namrata?
Hello, ma'am.
Ah,
Yeah,
yes, okay.
yeah,
Yes,
Sumit,
yeah. Good
please.
evening. Yeah, my question is also almost like it's partially answered by madam. Regarding like post PGDRP, what I have the update is like person is labeled as a clinical rehabilitation psychologist. But I don't know like what I
no.
have update regarding this because
No,
that
sir,
is
it is wrong. It is absolutely wrong. See, the name
okay.
itself is PGDRP. It is a rehab psychologist. So
Hmm.
they cannot be named as PG diploma in clinical rehabilitation. No. It's a very
Okay,
wrong notion.
okay. But over internet like free na, if you Google up this is the information which comes up. Yeah.
But sometimes misleads also.
Yeah, I agree. Yeah.
Yeah.
And one more thing, this NC AHP certification, ma'am, you talked about, this like anybody can like register after doing their MA. Like if we are from clinical counseling, whether RCI
Yes.
certified, then also we can take up this.
Yes, it will be
Whether it's
validated by
RCI,
the government. Yes, it
yeah,
will be
you
Okay,
will get
validated by the government.
right,
you will
right.
be getting a registration number as soon as you register, and I think the government will do a back end verification for that
Hmm. Hmm.
with all your
Okay,
certificates and other.
fine. Right, ma'am. Thank
Okay.
you. Thank you.
Sir.
Yes, Jennifer.
Yeah, good evening, ma'am.
Good evening.
So, ma'am, I have two questions. The first question is there is one course known as Professional Diploma in Clinical Psychology from MIT. So,
Yes.
after doing that, what will be the RCA? How we will be tagged as after MA Psychology?
See, after MA psychology, after you do the professional diploma in clinical psychology, which is a 1 year full-time course,
Yeah.
and basically it's totally a practical oriented course. Once you complete it, you will be known as associate clinical psychologist.
Okay, fine, ma'am.
And for
It is only
RCI license, actually, as Kavitha ma'am has mentioned that for RCI license, after you finish that respective course,
Yeah,
which is recognized from RCI registered institute,
yeah,
you have to apply for the license in the RCI website.
yes,
Okay, they will validate your documents, they will give you a CRR number, and it has validity, like 1 year, 2 year, 3 years, depending on what RCI license it is. And you have to renew it, upgrade your skills. Okay, it's not that you did the course and you get the license automatically.
yes, right.
It's not that way. So everybody make it very clear. It's not that you finish that RCI registered course and license come to your home. It is not that way. Once you finish the course, get the whatever percentage minimum requirement is there, you pass it, you apply for the license. Right, Kavitha?
you apply for the license and you will get the number also. After that, the CPD points has to be accumulated. See, usually the license is granted for 5 years. If you don't accumulate this continuous professional development points, then your license get expired. You won't be able to renew it. And Jennifer, see this, most of the amittees are having this PDCP courses. So you can, they are approved by RCI. Because I was searching for myself also. So, all the amittees which run this PDCP is mostly RCI licensed only. You can check on the RCI website as well.
Yeah, and one more question, ma'am. Like one of my friend is doing clinical psychology. She just wants to open. She just wants to open like a child developmental center, not to diagnose, just to help the autism kids or any special kids, just for guiding them. So for that also RCA registration will be required.
Yes.
What is she doing? What
She
is she doing?
she's going to finish her MA in clinical psychology.
Even if she finishes any kind of this kind of home or something which you're going to set up, it comes under rehabilitation. So she would require an RCI license.
Okay.
Without
Yes.
that, she cannot even apply for the center.
Yeah. Okay.
And she should have an RCI license. Plus, there are norms given on the RCI website for starting a center. So
Okay.
RCI will approve the center, then only you can start such centers. Okay,
both
Jennifer?
in both in RCI site and the Ministry of Social Empowerment and Justice. Both these sites have the rules and regulations for starting a rehabilitation center. See, anyways, even if she wants to start a center just for that, it is called a rehabilitation center. Whether it is one student, two student, no diagnosing, it is known as rehabilitation. So she has to have a valid license
Yeah.
and
Thank you.
follow the rules and regulations.
Yeah. Thank you. Thank you so much, Rindu ma'am and Kavitha ma'am. Thank you.
Welcome.
Great. Namrata, yes, please.
Thank you, ma'am, for the information and your time. My question is, if someone wants to start career as a school counselor, especially MA counseling psychology student, pass out. So, is it required RCI license? But some of the job openings they are showing the PG course plus RCI license. In job opening they are mentioning. So that's why I am asking. And
Kavita, yes, complete your question. Complete.
yeah, and second question is, since my background as a bachelor's, it is from other course, not psychology background. So will it create a problem? Means you were mentioning that new rule will be coming. So though I have completed my course before that rule is getting applied, so will it create any issue in future?
See, for school counselor, basically, as of now, I don't see, except for a special educator in school, they are not asking for a RCA license. If you go as a counselor in school, their RCA license is not required. You have to just do a skill certificate as a school counselor. That is all what I understand. Because why
Yes.
they are asking for RCI in school counseling, even I am not aware of it because it's the
There
first
may
time.
be special children. There may be.
Yeah, because usually for school counselors, they don't ask. They have special courses running for school counselors. You can take up that and you can just get appointed as school counselors. And
Okay.
regarding your UG and PGC, that's what I told Namrata. Every day RCI's rule is changing to something. So as of today, this is the rule. What it is going to be implemented next year. But we don't know, see, again, UGC has come out with the latest circular last month saying that you don't have to have any kind of basic degree in your, see, suppose I study science in school, but in my UG, I want to go for commerce, I can, provided I pass that entrance exam. So UGC has come out with a rule like that also. So it's very confusing. Let us wait and see what is happening to see this. Okay.
Okay. Okay. Thank you.
Okay. Okay. Anju Goyal. Anju, please ask your question.
Hello. Hello. Good
Yes.
evening, ma'am. My question is there any RCI license course available which I can do with my job? Because I'm working in a school already.
Yeah, you
Is there
can go
any?
from IGNOU, no? IGNOU has RCI recognized courses. It has B.Ed, it has M.Ed, it has PG diploma in rehab psychology. It has certificate course in inclusion for intellectual disability, hearing impairment, visual impairment. A number of courses are there. IGNOU from last July 24, they have enrolled for a number of courses with RCI.
I mean, these irregular programs?
No, these are not regular programs. These are called ODL programs. Okay, they will have a center which is attached to them where you will be able, you will have to go for 2 or 3 weeks to attend the practicals.
Okay, ma'am. So I can do with the job, that means, and I will get the
Yeah, it's an
certificate.
online course. You can write the exams and whatever it is, and only for those practicals you have to just go and attend it. Is it?
Okay, okay. After the completing that course, I will be able to get the RCA license also, that means.
Yes, yes.
Okay, thank you so much for the information, ma'am. Thank you so much.
Welcome.
Dr. Amol, please ask your question.
Hello, good evening, ma'am.
Good evening.
Yeah, so Kavitha ma'am, I think you have already mentioned and clarified, in terms of new regulations being changed and there is a lot of already confusion, but I'm just still going to go ahead and ask a few queries. So I come from a non-UG psychology background, currently pursuing MAC, MAPAC with IGNO. So if I still want to go back and pursue RCI licensed clinical psychology, the first thing is, will there be a possibility of I getting an admission one into this MIT recognized clinical psychology course, which is RCI license, or maybe if not there, if I'm still open to pursue full-time academic course, which is doctorate equivalent of Psych D or doctorate in psychology, will they consider me from a non-psychology UG degree background eligible to apply there? I mean, is there some sort of clarity or understanding on these cases?
Will, because most of my friends who have completed, I have a person who is also 65 years. He's pursuing his MPhil in clinical psychology from one institute in Telangana. Okay, he's not from UG, is not from psychology. He has just done PG and he's doing. But again, we'll have to wait for the new regulation to come in next year. I think so that they will definitely come in for something which is for non-UG non-psychology background students, because there are so many non-psychology background students, and the demand in the country is so much that they cannot just stop doing. Otherwise, it will start creating a lot of problem. Already there are less psychologists, and there are a lot of problems which are growing on. I think definitely they'll come out with a new circular, hopefully.
Yeah. Here, let me make it very clear. New education policy 2020, it was supposed to be implemented in 2020. Due to some reasons, it has now been implemented from June 2024. Okay. And this is for students who are entering into the psychology now. जिनका हो गया है उनके लिए पुराने रूल्स ही चलेंगे, लेकिन जिनका अभी एडमिशन हो रहा है उनके लिए ये रूल्स है कि बीए अंडर ग्रेजुएट 4 ईयर कोर्स होना ही चाहिए साइकोलॉजी में, तभी ही आप एमए साइकोलॉजी साइड साइकोलॉजी वो करोगे आरसीआई रजिस्टर्ड इंस्टीट्यूट से टू गेट एन आरसीआई लाइसेंस ऑफ क्लिनिकल साइकोलॉजिस्ट. So
Okay,
I
okay.
request everyone ki I've shared the WhatsApp group link on Psychology Talks also. If you're not in that, please join it. My number I've shared. I will share the document of new education policy. आप प्लीज उसको पढ़िए, अच्छे से पढ़िए, आरसीआई की वेबसाइट पे जाके सारे डिटेल्स खुद पढ़िए, तसल्ली कीजिए, कंफ्यूज मत होइए, गूगल मत कीजिए अजीब से जगहों पर. Okay, this is very, very important. You get to hear from some WhatsApp group, some IGNU group, and something your seniors are saying. I don't know. I get all silly questions all the time. तो go to authentic websites, Rehab Council of India, उसकी वेबसाइट पे जाइए. न्यू एजुकेशन पॉलिसी 2020 का डॉक्यूमेंट हम शेयर करेंगे, उसको देखिए. जून 2024 से ये अप्लाई हो गया है नए बच्चों के लिए. जिन्होंने 3 साल बीए साइकोलॉजी किया है पुराने लोगों ने, उनके लिए ब्रिज कोर्स है टू कंप्लीट 4 ईयर बीए साइकोलॉजी एंड देन एंटर द मास्टर्स इन क्लिनिकल साइकोलॉजी. Okay, so read the new education policy document very properly.
उनका क्वेश्चन उनका यूजी, इट इज नॉट फ्रॉम साइकोलॉजी.
Yes, yes. So for old students तो अभी कुछ नहीं है ना, मैं नए बच्चों के लिए रूल्स है ये. तो आपको फिर भी कुछ देखना पड़ेगा. एमफिल स्क्रैप हो गया है और आपको पीएचडी के लिए आरसीआई में पूछना पड़ेगा कि क्या पॉसिबिलिटीज है.
Okay,
And
so it's still not clear, but like you said, looking at the overall situation in the country, they might have some leeway for non-UG this thing.
Something
yeah,
they
yeah,
will come
definitely
out with
something will
some
come,
bridge course or some
or
entrance exam,
something
कुछ
will
तो करेंगे.
Correct.
they'll
Ma'am,
come
और
out
ये
with something.
yeah, जो MIT का कोर्स के बारे में will it be possible to quickly share the link या
See,
direct us?
अमिटी का जो है, एक बार आप आरसीआई के वेबसाइट पे देखिए कि वो अमिटी वो वाला सेंटर आरसीआई में रजिस्टर्ड है कि नहीं है, लिस्ट में नाम है कि नहीं है.
Okay, sure.
हाँ,
Okay.
ठीक है.
But
जैसे यूजीसी की वेबसाइट पे यूनिवर्सिटी
हाँ,
की लिस्ट होती है, आरसीआई की वेबसाइट पर उनके रजिस्टर्ड इंस्टीट्यूट्स का
और
लिस्ट
there
है.
in the if you go regular courses में और approved institutions का list रहता है, तो
Correct.
time and again keep checking it because they suddenly blacklist the institution also.
agreed.
And maybe Amity का वो particular branch में नहीं है, that also we cannot say.
And
Sure.
other thing is कि अमिटी में personally visit करना की faculty है कि नहीं, even though it is
Right.
registered under RCI.
हाँ, that's
Oh,
another
in
agreed.
this I want to tell something. I had a friend who did this rehab psychology with me. She's a discontinued from Amity and she joined with me because she couldn't, उधर पे नहीं थे. There were no student teachers there.
Yeah, I mean, in India, I mean, there is always this tussle. But I know this is on the lighter note, but now when we all are struggling to at least be formally out from an accredited institute, whether we have really learned or gained that skill is another different issue. I'm just trying to get clarity कि this MIT recognized clinical psychology RCI registered ones, they admit people who are from non-psychology UG background.
That is a common rule. You have to check at RCI website, Amol.
Okay, so it's not dependent on the admitting university. What you are saying?
No. अगर वो RCI affiliated course है तो उसके eligibility RCI की ही होगी, यूनिवर्सिटी की नहीं होगी.
RCI
Okay.
का, if it is an RCI course, RCI can, no institute can say that they will not take a person who doesn't have so much. Their basic rule is only MA or MSc psychology with 55%. इतना ही है उनका. ठीक है. Otherwise, they'll have to admit the students.
Okay. So I think I got this clarity that the eligibility has to come from RCI rather than the institute.
Yes.
Correct.
क्योंकि लाइसेंस आरसीआई देगा ना आफ्टर ऑल. आप डॉक्टर हैं, आपको पता है मेडिकल काउंसिल कैसे काम करती है.
I know. No worries. Thank you for that clarity.
Okay. Yes, Nikita, please.
Yeah, good evening, ma'am.
Good evening.
Yeah, I had a question. You spoke about the nomenclature RCI gives with respect to individual courses. So suppose we do PDCP course. I checked once at RCI website. It was mentioned associate clinical psychologist, and if you do PsyD, you are known as like an expert level clinical psychologist. So does this tag mean that you have to practice under a clinical psychologist or you can independently practice?
See, ideally there should be a supervisor if you are doing a PDCP course. But all the assessments and other things can be done by you individually and signed off by a MPhil person. Okay. But if you want to open, if you are asking me if I can open my own center for psychology, yes, you can open. Only thing, your tests, whatever it is, see, if you're talking about assessments we can do now also.
Okay.
As a psychologist, anybody can do any assessments, but we cannot validate the assessments. That is why we require a RCI license.
What do you mean by validate?
Validate in the sense, see, suppose I am taking an IQ test for myself. I mean, so Rinku is taking an IQ test of mine. Okay, Rinku cannot certify that Kavitha is having an this much IQ or something unless I have unless Rinku has a RCI license.
It is not legally valid to give a signed document in simple language.
Signed document. Correct. So
Okay.
Nikita, suppose I want to assess Nikita for anger issues. मैं अभी भी उसको कर सकती हूँ. मेरा पास assessment है. Link को always forward that assessment का link, उससे मैं कर सकती हूँ. But मैं declare नहीं कर सकती कि I can't sign the document and the reference purpose.
Okay, so would that be considered ethical or?
नहीं नहीं, देखो अभी सिंपल मैं ले लैंग्वेज में बात करती हूँ, ठीक है। आप एमबीबीएस डॉक्टर के पास गए, उसने दवाई अपने लेटर हेड पे लिख के दिया, आप केमिस्ट के पास गए और आपने दवाई ले ली, ठीक है, लीगल है, एथिकल है, करेक्ट। लेकिन आप सीधा केमिस्ट के पास गए, आपने अपने सिम्टम्स बताए, उसने दवाई दी। केमिस्ट प्रिस्क्रिप्शन नहीं देता है।
राइट।
अगर वो प्रिस्क्रिप्शन देगा तो पकड़ा जाएगा, वो लीगल नहीं है।
ओके।
तो आपने अगर एक बच्चे का लर्निंग डिसेबिलिटी का टेस्ट किया, आपको पता है इसको डिसलेक्सिया है, लेकिन आप उसको ऑथेंटिक लीगली कोई हैंड रिटन रिपोर्ट नहीं दे सकते आपकी सिग्नेचर के लिए। वो कहीं पे भी जाके लीगली नहीं बोल सकता कि उसको डिसलेक्सिया है।
ओके।
अगर आपके पास आरसीआई लाइसेंस है तो आप एलिजिबल हो कि आप टेस्ट करोगे, उसका डिसलेक्सिया डायग्नोज करोगे, प्रॉपर लिख के दोगे, ताकि स्कूल में एग्जाम्स में वो लीगली वो डॉक्यूमेंट दिखा के जो भी उसको कंसेशन मिलना है मिल सके। इफ यू आर एन आरसीआई लाइसेंस्ड क्लिनिकल साइकोलॉजिस्ट or a licensed person who is authorized to give such certificates.
So, if you do MAPC and then you do PDCP and get an RCI license, then will your
What
assessment be
is
valid?
PGDCP? What is that?
PDCP,
हाँ, what is that?
Postgraduate Diploma in Clinical Psychology.
हाँ, तो
Professional
उसमें
diploma in
उसमें आप
clinical.
पढ़ोगे कि ये आरसीआई लाइसेंस के क्या आपके पास अथॉरिटीज हैं, वो आप
Okay.
लाइसेंस में मिल जाएंगे आपको, क्या क्या आप
Okay.
कहाँ कर सकते हैं,
Okay.
ठीक है। आप ऐसे फ्री फंड में नहीं कर सकते,
Okay.
ठीक है।
हाँ, second
ओके,
question
डॉक्टर्स
था.
का देखो, जो डॉक्टर्स का रूल्स होता है ना, वैसे ही क्लिनिकल साइकोलॉजिस्ट के लिए होता है, ये आप एनालॉजी को समझ।
So under every nomenclature, there will be only
ऑफ
specific things you
कोर्स, ऑफ
can do.
कोर्स। अब जैसे आपने डीएड किया, स्पेशल एजुकेशन में आरसीआई लाइसेंस लिया, आप उतने के लिए एलिजिबल हो ना। आप जाकर के बाइपोलर डिसऑर्डर, सिजोफ्रेनिया नहीं ट्रीट कर सकते।
Okay.
ओके, गॉट
So,
इट।
ma'am, for counselor, if you want to have RCI license for credibility, तो MAPC के बाद those 3 certificate courses that ma'am said IGNU has, क्या वो sufficient होगा to get that credibility
नॉन क्लिनिकल
of?
प्लेसेस के लिए यू कैन, आप
Okay.
उसकी वो पढ़ो
CSC
पहले।
IID वो जो है इट इज फॉर इंटेलेक्चुअल इंक्लूजन के लिए है, वो जो तीनों सर्टिफिकेट है, you will get an RCA number with it.
Okay.
Okay,
So as a
and
counselor, you can get some credibility that you're a registered person, you have some
yeah, you
certificate.
can say that you are as an inclusion educator for intellectual disability, you are registered with RCA. Maybe you can use that.
So we can't use counselor term.
नहीं, काउंसलर
You are
टोटली
doing
अलग हो गया।
Okay.
We will
तो
discuss that.
psychologist नहीं बोल सकते.
We'll discuss that
आप
separately. Nikita, you can connect with
यूज कर
Kavitha.
रहे हो ना?
हाँ,
Okay.
okay. Yes, VM. I don't know your full name. You can please ask your question.
Hi, ma'am. Good evening. Sorry, I was a little late joining the Zoom call, so I have missed a lot. So I might be repeating everybody's question. But I am doing MA from IGNU in clinical psychology. So my question is very simple. After finishing my MA, do I need to do a further course with RCI to get the license, or can I directly apply for a license?
Course.
You can't apply for a license with MA. No.
Okay.
Okay, you will have to do an RCI accredited course. See, RCI is only a licensing body. RCI has a set of universities and colleges affiliated to them from where you will have to do these courses. And these are full-time courses. There are no, except for IGNO, nobody else offers it in offline. So you'll have to go and, I mean, in online, you will have to go and do those courses and get your RCI.
So will IGNU again provide another course which I have to do before applying for the license, or I'll have to find another university completely?
No, see, IGNO from last year, July 24, say, we have started with 4 or 5 RCA related courses, which the details are available in their website. They have started with PG Diploma and Rehab Psychology and 2-3 certificate courses and B.Ed and M.Ed in special education and all. Okay, so these announcement where you'll have to look out in IGNO's website, as and when the announcement happens, you can apply for it and do the course from there on.
Okay, so say if I do a course in rehab with IGNU, okay, and I get my RCI license, post that, can I work in any hospital as a clinical psychologist or no?
No, you can't, because the PG diploma which you do from IGNOU is for a rehabilitation psychologist or a rehab counselor. So that doesn't enable you as a clinical psychologist. For working in a hospital setup, since you're doing MA, you can work now also as a counselor.
As
You
a
can't work
counselor,
as a
I can.
you can't work as a clinical psychologist, but you can work as a counselor.
Okay. And if I want to push for clinical, I need to find different courses for it before I
You
do.
will have to do a clinical. See, if you're very interested in clinical, then you'll have to do only a clinical psychology course, which is an MPhil or which is a professional diploma in clinical psychology. These are the two courses which are available as of now.
Okay. Professional course for clinical psychology. So PDCP is what everybody's saying.
Yeah, professional diploma in clinical psychology.
Okay. But that is yet not there in IGNOU.
It's not there in IGNOU, and I don't think it would come also because it's totally a practical oriented course. So, you know, they
Okay.
need it needs a lot of management actually.
Okay.
IGNOU maybe doesn't have the bandwidth to do that.
Maybe. Ma'am, do you know of any college in Bombay doing this with RCI?
Okay, yes, that you have to check at RCI website
You'll
because
have to check
individual
with the RCI
universities.
website.
Okay,
It
okay.
keeps
Okay, ma'am.
changing, you know, every time it keeps changing. So you'll have to look at the RCI website
Okay.
for regular distance and for the blacklisted institutes also.
Okay,
Okay.
and I have shared the WhatsApp group link in the chat. You can join that. There I will be sharing all the documents and the links. You can have my number is there, and we'll also share Kavitha's number at the end. Yes,
Okay.
Jankhana, I hope VM,
No,
you
I
have
have
finished
one
with the questions. So
small
wait
question.
a minute. Wait a minute.
Hello.
VM, have you finished with the questions?
Yes.
I
Good
just
evening.
wanted one more.
Yeah.
If I do my MA and while I am studying, say, MPhil or clinical or any other course, can I have a counseling clinic of my own?
Huh.
No, you're not
Yes.
supposed to do. No, they're not supposed to do.
Sorry.
If they're
What's
doing,
the question?
they're doing a course in RCI, you're not supposed to work.
Okay.
Oh, okay. Okay. Okay.
You
Thank
won't
you.
have time anyways.
Okay, ma'am. Thank you.
Okay. Yes, Jankhana.
Hello.
Yeah.
Ma'am, I have a query related to RCI again, though I have done my IGNOU course, Masters in Clinical Psychology. Ma'am, I was already in RCI registered. I had done this course from SNDT Juhu, a special education course, which had an RCI registration. But because of a break that I took, as you said, after 5 years, it gets lapsed. So that is what has happened. And I have been applying for the RCI online, but I'm not getting any response from them. So I've been actually applying, I want to get my RCI number again. I don't know why, but I'm not getting any response from them. So I've online already paid twice. Do you have any idea about how do I go about it so that I can get
Where are
my...
you based out of, Jankhana?
Sorry?
Where are you based out of?
Mumbai.
Okay, you're in Mumbai. Okay. Yeah, I'll share some email ID of the deputy director and the phone number. Maybe you can follow up. But what was it is RCA from last 3-4 months, they are a bit confused because they had an upgrade of their system. So the system is still not, come back into the actual this thing. So a lot of verifications are pending in still. And regarding the CPD points, maybe because of that your registration has got expired. Have you collected the CPD points?
Ma'am, I've been working in the same field, so not really that I have points, but I have got experience of 8 years in the
No,
field.
that
So
doesn't,
that will not
that
work.
doesn't come with
No, you have to follow the rules.
You have to
Oh,
follow the rules. They have, they keep announcing in their site itself that this thing, you'll have to go and enroll in that. And there are offline and online courses which happen, workshops, 2 days workshop, 3 days workshop.
okay.
You'll have to attend, and each workshop has points, 5 points, 18 points, 24 points, like that. So you'll have to collect a maximum of 100 points only for 5 years. I think that's quite easy. You'll have to check with them. The only thing is you'll have to mail them and check, or you can call them.
Correct.
Yes.
Ma'am, can you please share the contact number or maybe the email
No,
ID?
Jankhana, that we can
I-
connect with Kavitha one-on-one basis,
No
or
problem.
you can visit the website. Okay.
Thank you so much, ma'am.
Okay. Yes, Suresh, can you please ask the question?
Yes, ma'am. Good evening. Ma'am,
Evening.
hello.
Yes,
Am I
sir.
audible?
Yeah.
Yeah, you
Yeah.
are. You are.
जी मैम, सबसे पहले तो मैं इसमें ये पॉइंट क्लियर करना चाहता हूँ, जैसे मैम ने अभी पूछा था उसका जो लाइसेंस का, तो आई थिंक जैसे मैंने अभी बीएड स्पेशल फर्स्ट सेमेस्टर में एडमिशन लिया है और मेरा ये मार्च में एग्जाम स्टार्ट होगा, तो एज पर न्यू पॉलिसी अभी उसमें आ गया कि मिनिमम 2 क्रेडिट हमें अर्न करना पड़ेगा। मेरे को भी डायरेक्शन मिला और मैंने स्वयं ऐप पर अपने आप को रजिस्टर किया है और उसके 2 क्रेडिट हमें अर्न करना पड़ेगा। अगर वो अर्न नहीं होंगे तो हमारा आरसीआई का प्रोसीजर कंप्लीट नहीं होगा। ये अभी लेटेस्ट रूलिंग है, पहली चीज। दूसरी चीज मैम, अभी मेरा ये अपने लिए है क्वेश्चन कि एमए साइकोलॉजी सेकेंड ईयर में मैंने क्लिनिकल ऑप्ट किया था। टीचिंग प्रोफेशन में ऑलरेडी हूँ अभी नॉर्मल, और अभी मैं बीएड इन स्पेशल एजुकेशन कर रहा हूँ और उसमें स्पेशलाइजेशन है हियरिंग इम्पार्टमेंट HI। तो बीएड स्पेशल के बेस पर आरसीआई लाइसेंस हमें मिलेगा और एज पर प्रैक्टिकली हम जो भी स्पेशल स्कूल होते हैं, नॉर्मल स्कूल में स्पेशल एजुकेटर होते हैं, दैट इज बेटर, लेकिन जो स्पेशल स्कूल होते हैं जहाँ पर सीवियर स्टेज के कैंडिडेट्स भी होते हैं, तो हम वहाँ पर भी जाके लर्निंग करते हैं। तो वर्क हमारा जो है वो सीवियर स्टूडेंट्स पर भी हो रहा है। तो जब हमें आरसीआई लाइसेंस मिल जाएगा तो सो दैट ऑन द बेसिस ऑफ क्लिनिकल एमए डिग्री फ्रॉम इग्नू और RCI license in B.Ed special education, can I do work as a clinical psychologist or not?
No.
No, you can't.
Okay, thank you.
Okay. उसका पूरा प्रोसेस अलग है। Yes, Sumit, your question?
Hello, ma'am. Yeah, just a question came up to my mind. Since you were talking about like institutes, like we have to verify and they have to be RCI licensed. So, in what if, ma'am, a situation in case somebody takes an admission and later on the institute, after taking admission, maybe after 6 months, 4 months, it is removed from the RCI list of approved institutions. So, what will be the status of that student admission of the student?
RCI usually recommends for those students to another institute to take refer to another institute to continue their study. Or they, midway may usually they won't do that. Ideally, they will usually ask for the
From a fresh
completed
session,
thing.
like.
Yeah, mid-session they will not do. They will usually tell for the next session, and then again, tab se they'll say, suppose you have taken admission in 24, 25, they'll say like 25, 26, 26, 27, say don't take admissions in this course.
Fine, ma'am.
So you can just, midway they won't affect.
Okay. Thank you, ma'am. Thank you.
Okay, so a very good session with Kavitha and everyone here. I hope you have benefited from all the discussion. We'll be sharing the YouTube link in our psychology talks and other groups once we upload this on our mobile app. Amitabh Psychology app is available in the Play Store of Android and your iPhones. That this will be available, plus the YouTube channel of Amitabh Psychology, you can watch there. Any questions related to this? Yes, Kavitha, if you could share your number in the chat so that if anybody wants to connect with you directly, they can. And I have shared my number and also the WhatsApp group link. You can join the link. Kavitha has shared her number. Any questions, anything, before any doubts, please visit authentic websites of RCI, www.rehabcouncilofindia.com.
No Googling.
No Googling, right. And talk to authentic people who have already taken RCI license. You have plenty of RCI license which are described in RCI website. Okay, D.Ed है, B.Ed है. जैसे अभी सुरेश जी ने बताया कि हियरिंग इम्पेयरमेंट में है, बहुत सारे RCI लाइसेंस हैं, लेकिन वो RCI लाइसेंस आपको क्लिनिकल साइकोलॉजिस्ट नहीं बनाते हैं। ये आप प्लीज क्लियर कीजिए। क्लिनिकल साइकोलॉजिस्ट का पाथ टोटली डिफरेंट है। PhD इज कंपल्सरी. Okay, so
that PhD also we cannot practice as a clinical psychologist. We
Huh.
can, but we can teach the clinical
Yes.
psychology students.
So
If you want to
RCI
practice as
mentioned,
if you want to
sorry.
practice as the clinical psychologist, we'll have to do PsyD, which is a 4-year course, and you can address yourself as a PsyD person.
Right. And that is also again under RCI registered institute. So again mentioning, check the approved institutes on RCI website, first thing. Second thing, go and check in that institute if faculties are available. Okay. So thank you so much and well in time. Thank you, Kavitha. Thank you so much for this
Thank
lovely
you for this
session.
opportunity. Thank
Right.
you.
And more such sessions, we invite speakers, experts in their own fields. And yes, to announce before I stop the session, Women's Day, we are having a special session on something really what women need, but men can also join it to understand what women need, right? So do join with us on 8th of March for our next session, and we'll be having one more session with Kavitha in March. Thank you so much, everyone. Good night. Bye.
Bye.
Thank you. Thank you.